All right, very good.
Okay, everybody's good? All right, stand by. And we're going in 10, 9, 8, 7, 6, 5, 4.
And good afternoon, everyone. Glad you could be here with us this afternoon. Mayor Demings has been meeting and speaking with public and private organizations and their leaders in this rapidly changing climate. And indeed, this is a rapidly changing climate. To give details as to where we are here in Orange County is our Mayor Jerry Demings. And let me tell you who will be speaking today. It will be Mayor Jerry Demings, followed by Orlando Mayor Buddy Dyer, then Dr. Al Pino, the Orange County Director of the Florida Department of Health, then Dr. Yolanda Martinez, the Director of Orange County Health Services, then our own Dr. Barbara Jenkins, Orange County Public School Superintendent, and last but certainly not least is Jeff Hayward, President and CEO of Heart of United Way here in Orlando. First, we start with Mayor Demings. Mayor Demings.
All right, let me begin by just saying thank you to all of you once again for being here. Our goal this afternoon is to give you the most recent update regarding how the COVID-19 virus has impacted us right here in Orange County and some of the response efforts that we have put in place going forward. We know that this is really a challenging time, and there have been major developments happening today almost hourly. This appears to be our new normal. Each day we will see developments occurring throughout our community on an hourly basis, and we will endeavor to keep you as informed as we possibly can. Within the past few hours, I met with industry representatives from our local hotels and hospitals via teleconference to discuss and coordinate community responses to this pandemic. Hospitals have command teams established, and they're in place, ready and prepared to increase the level of testing both within the private facilities. And I will tell you also that we have been in conversation with the Florida Department of Emergency Management and FEMA on the establishment of a testing site here in Orange County at the Orange County Convention Center for the public. That is something that you'll hear more details about in just a few moments from Dr. Pino from the Florida Department of Health in terms of the projection for opening that particular facility. I want our residents to know that this is going to be an uncomfortable period of time that we're going to be living within for the next several weeks, perhaps several months. But we are working together in this community to address the needs, and I have to say thank you to our community-based organizations and other governments at all levels for the cooperation that we are receiving at this point. With the closure of bars, nightclubs, and restrictions that have been placed on restaurants, we believe that we can control the spread of the virus in this community. You will hear in just a few moments from the Orange County Public Schools and Dr. Barbara Jenkins. You will hear from county health leaders, and you'll hear from United Way officials about what is being done in this community to address the needs of our families. Orange County now has 9 confirmed coronavirus cases, COVID-19 cases here within this county. This is an increase of 3 cases from Tuesday when we last had a countywide press event. Dr. Pino will share details with you on the new cases. I want to recap our actions concerning drinking establishments and restaurants. We are following the directive of the governor. All bars and nightclubs are closed in Orange County for, at a minimum, the next 30 days. The Department of Business and Professional Regulation will be enforcing this, and you can refer any inquiries to the Department of Business and Professional Regulation. But I will also say, after meeting early and talking with Sheriff Mina from the Orange County Sheriff's Office, local law enforcement may also be made aware of obvious violations. Restaurants are required to limit customer entry to 50% of their capacity. Seating must be staggered and limited to ensure parties are separated by a distance of at least 6 feet. We highly encourage restaurants to remain open for takeout and delivery services. With the closure of our major theme parks, many sectors of our tourism industry really are hurting. they're hurting deeply at this point. In fact, when I had conversations earlier today with many of our hotel operators, they told me that for the first time for some of them in the history of operating hotels, they are closing hotels in this community. And that is something that I will tell you that it is sad to see, but it is something that is necessary because of the decline in the occupancy rates within our hotels. And so we know that that means that there will be additional workers, service workers from the hotel industry who will be displaced, which calls for additional assistance from our community. We're expanding our crisis assistance program here at Orange County to help those who are rent stressed and need help with utilities. We will be establishing a crisis assistance hotline in order to help up to 1,500 families for the next several months. We have more details about that will be announced within the next couple of days about how that process will occur. The goal is to fill the gap between now and the period of time additional federal or state dollars in the way of assistance will come into our community. I will say to you that our hospitals are saying to me that they have been overwhelmed with a number of people who are feeling the symptoms of what may be influenza or other maladies going into our ERs and urgent care facilities. And we want to address all of those needs, and we as a community have plans of actions to be able to do that. At this time, I'm going to turn it over to Mayor Buddy Dyer from Orlando to share additional details with you, and then the others will speak accordingly.
Thank you, Mayor Demings, and I also want to thank the press for helping us get the information out that our community needs. I want to acknowledge Commissioner Burns, who's here with us from the City of Orlando. Thank you for being here. Bakari, you know, every day, really every hour, we're making difficult decisions as a city government. We're not taking any of those decisions lightly. Every decision impacts our residents, our businesses, and they're all made in an effort to stop the spread of this COVID-19 and to save the lives of our residents. Today, the City of Orlando Emergency Operations Center is activated to a level 2. Starting tomorrow, Thursday, March 19th, essential city services will be managed and delivered remotely as much as possible. We're encouraging our residents to interact with our city government remotely using online and phone methods. About 95% of the services that you can access through the City of Orlando, 290 municipal services, can be accessed online at orlando.gov, and we encourage you to do that. We've told you previously that we're triaging calls for medical help as it relates to the virus, but additionally, we're updating our protocol for firefighters and EMT who are responding to calls that relate to a respiratory illness. We're now asking if the patient is able to meet the paramedics outside of your home or business, as long as you are capable of having a walking condition and it doesn't compromise your medical condition. So the 911 service is going to ask you whether you're capable of doing that, and they will let the firefighters know whether you can do that. Our transportation partners continue to serve our residents. Sunrail and Lynx play critical roles in essential services for our community. Both of these entities are taking additional precautions, cleaning platforms, cleaning their trains, cleaning their buses, but they continue to operate on schedule and normal, as does the Orlando International Airport, who is providing normal operation, again with additional cleaning services, additional precautions. The airport passenger count is down. Obviously, there's a number of international flights that are no longer flying due to the travel ban, but domestic service is also down. Our city utility, OUC, continues to provide its critical services. If there's a service outage, they're going to respond. The Reliable Plaza Walk-in Business Center is closed, but you can conduct business with them over the phone or online, and they have suspended disconnects for electrical or water service due to non-service until further notice. At the city, we've received a lot of questions about mandating business closures on both sides of that equation, people that think businesses should close and people that are concerned that they shouldn't. And we want you to know that we don't want to create additional financial hardships on our local businesses or their employees by adding additional restrictions. So we'll continue to look for guidance from the state and federal government as it relates to additional regulation relating to commercial establishments, and of course we'll want to coordinate with the county on anything we do as well. I encourage businesses to take proactive measures to practice social distancing and make sure you take care of your employees. I'm asking that all residents, young, old, or in between, be patient, be selfless, and adhere to the guidelines that the CDC has established. Our residents and our businesses are certainly, as Mayor Demings has indicated, already experiencing financial strain. This is an unprecedented and trying time, not just here in Central Florida, but nationwide and around the world. We're grateful for our partners like Heart of Florida United Way, who's helping connect residents with financial assistance through their 211 program, and the establishment of a fund to assist our ALICE workers, and to Second Harvest Food Bank, who's helping us feed those in need. The state of Florida has enacted a Florida Small Business Emergency Bridge Loan Program that'll support small businesses impacted with short-term interest-free loans. Our Economic Development Department is able, ready, and willing to assist anybody that needs additional information on how to apply for that. I encourage our residents to take advantage of the ways you can support our residents and businesses. So one way I'm wearing as a badge of honor, Mayor Demings and I and other members of the county and city staff donated blood, and there's been a lot of cancellation of blood drives, so they are in desperate need of additional donations. It's a safe thing to do, and it's a thing that you can do to assist your neighbors. Donate to Second Harvest. Support our local restaurants by getting takeout or curbside delivery, and check on your neighbors and your family. I also encourage you to take care of yourself, eat healthy meals, exercise outside, and as I was reminded recently, everybody's under a little stress and anxiety, maybe a lot of stress and anxiety, and that can affect your immune system. So figure out the way you can eliminate your stress, or at least reduce it, whether it's yoga or meditation, sorry, or cooking. This, quite honestly, is one of the greatest challenges our community has ever faced, and everybody up here and everybody in this community right now should be concerned with one thing: how do we stop the spread of this virus? Doctor.
Thank you, Mayor. Thank you for the press for being here. My name is Raul Pino. I'm the health officer for the county, and I would like to highlight some points before I go into the main elements of the news. And as we, the Department of Health, switch from preparedness to pandemic response, our services are going to be reduced in areas that we normally provide services, and in some cases eliminated, so that we can respond to the challenges that we are facing. With that, I want the public who use our services to call our institution before they show up to be sure that those services are being provided, that there is an appointment, and we have a solution for the case. Most services will run in a 25% mode. It will be dedicated for those who are in highest needs. With regard to testing, as you heard from our mayors, there's going to be a regional site at the convention center that we probably will be operational in the next 48 hours. We are waiting for information. As we speak, all the deliverables are getting into place, and it's going to be managed by the National Guard, and I'm pretty sure that we will play a support role in those efforts. That's going to be a large event. We dive through, but that testing site, as well as our own, we will be opening in a smaller scale testing site on the east side of town in the Alafayal Trail area, and that will be by appointment, and it will be for people who qualify to be tested. With that, it is important, we know that there are some level of anxiety in our community, but it's critical, important two elements. First, do not go to the ER if you don't have to. And going through the ER is for a life-threatening event. It's not just for a fever, or I don't feel well, or I wanted to be tested. We need the media support in sending this message. Our ERs will be overwhelmed, our system overrun, and we will not have the capacity to respond to those who really need it. And most people will experience the flu, the common cold, or even with the coronavirus. About 80% of the people will just experience a mild version of this condition. So if you don't feel well, please call your primary care provider before you walk into an ER so that we can assess your needs at the lowest level of the healthcare system, because doing it at that level will overrun the ERs. Every patient that goes to ER is a mask, is a PPE, is the resources that has to be discarded, and in a time like this, it's critically important that we reserve our resources because this is just the beginning. With that and the number of cases, the Mayor Demings mentioned that we have 9 cases. 3 new cases were reported today. I have information in 2 of those. The latest case was just reported, so I will not have that one. But case number 7, which is the first reported today, is a 60-year-old male. He's a resident of our county, and he lived here only for 2 months of the year. But coincidentally, he's here in our county right now, traveled to South Asia, and developed symptoms on 3/16, and is currently hospitalized with pneumonia. The case number 8 was also reported today. It's a 73-year-old. We don't know when or why it was acquired, but we are under investigating that. And the person was also admitted to the hospital. And we have the 3rd case, another male who is 57 years old, and we don't know how it was acquired yet, but we are in the process. This was just reported. With that, I wanted to pass it down to Dr. Martinez from County Health Systems.
Thank you very much, Dr. Pino, and good afternoon to everyone. I just wanted to bring again a message of reminder to everybody in our county, all of our residents, to, as we go through this process and we continue to increase the number of cases that are positive, we don't forget what we need to do individually to help to stop the spread of the COVID coronavirus. I want to reiterate some of the messages brought by our mayors. We're working on this together. Mayor Demings today, as he mentioned, he's had conversations with some of the community partners, including the hospitals. With the hospitals, that being said, we need to recognize and give kudos to all those first responders and medical people who are the front line and the front face of what we're facing and we might be facing in the near future. So we need to be very knowledgeable of that, be patient with them, be caring, just as they're very caring with us as they try to heal us and make us better, and so that we can go on, we need to be very caring with them as well. And as Dr. Pino mentioned, if you need to go to the hospital, make sure that it is for a reason that validates you being at the emergency room, whether you have chest pain, whether you're under respiratory distress. If you're just experiencing mild symptoms, contact your doctors because they are the ones that can give you a better guidance. Please leave the emergency rooms and the hospitals for those individuals that really need that level of care to be able to make it through this crisis. Thank you very much, and I'd like to turn it now to Dr. Jenkins, Orange County Public Schools.
Thank you, Dr. Martinez. I certainly want to thank as well all of those in leadership in our community, both of our mayors and my other colleagues standing here for the tremendous work being done on behalf of our entire community. So let's talk about schools briefly. In case you hadn't heard, schools are actually going to keep children out per the state's recommendation and CDC advisory through April 15th. I want to be very clear, all of our directions from the state remain fluid because a couple of weeks ago we weren't going to close at all, and then we added a week to spring break, and now we're closed through the 15th. And I don't want anyone to think that is the end of the journey we might have before us when it comes to fighting this virus. I want to recognize the state, our Commissioner Corcoran, State Department of Education, for being extremely vigilant and strong in their leadership for this whole matter. So what happens with schools? Our teachers are actually prepared to provide digital learning for our students Younger students will have educational packets provided for them. But as you well know, thanks to our taxpayers, our middle and high schools and 1/3 of our elementary schools have 1-to-1 digital ratio. So our middle and high schoolers actually take their laptops home with them on a regular basis. Our elementary school students would need to retrieve their laptops once we give those directions. Our teachers are prepared to do digital and online training in preparation for digital learning in the coming days, and then we will have distance learning for our children. The expectation is, no matter what goes on in our community, that we still provide education for our young people. At the same time, we have to be extremely careful and try to keep our employees and our entire community safe. And so I think you'll be pleased with the protocol that we're putting in place, where we have minimal contact with individuals, employees have minimal contact with one another, and we have digital online learning for our young people. Plan is, once we have all of our agreements in place, that the majority of that work happens from home. Let me also mention, for parents, I understand it's quite a hardship if you are still working and your child has to participate in learning at home. Don't have solutions for you. I want you to know we understand the hardship that it places on you. At the end of the day, we still want to make sure we're providing education for our students. We are committed to providing daily and weekly updates as we receive information. I have a conference call this afternoon at 4:30. We will update both our community, our parents, our employees, and those who have an interest in Orange County Public Schools. Let me thank again both our local elected officials. I want to thank especially my school board, who are always singularly focused on what is good for our children and also committed to doing what is best and right for our students. Before I leave the podium, let me also remind folks we've got 50 schools providing free lunches and breakfasts for our young people. Check on our website, ocps.net. You can find all of that information, 50 different sites. You don't need ID. The child just needs to be present. Anyone under 18, we will feed lunch and breakfast at our sites. Check our website for information. And I would be remiss if I didn't also mention census information has started. And we want everyone, though you might be overtaken with and overwhelmed with what's going on, we want to remind folks, please do not forget to fill out that census information. It will have critical impact for our entire community and certainly for our public schools. Thanks in advance to our wonderful teachers who are going to be so creative in getting the work done with our young people, and thanks to parents and families who will support those efforts as well with your young people. That being said, let me introduce Jeff Hayward. I told him I was going to mispronounce his name. Let me start again. Jeff Hayward from the Heart of Florida United Way.
Thank you, Dr. Jenkins. I think this community recognizes the value of 211. By virtue, it turns to 211 after hurricanes and any other disaster. And we're very proud at Heart of Florida United Way to deliver that service to the community. But I also think that we have to acknowledge right now that these are unprecedented times. We are facing at 211 right now unprecedented volume. As of 2:30 this afternoon, we had nearly 2,400 calls come into the center. We average 700 a day in a 24-hour period. We've received almost 700 COVID-19 related calls. Questions like, what are the symptoms? Where do I go for testing? And so forth. We've received, of those calls, hundreds also seeking financial help. Folks who have been already told their hours will be cut back or their jobs will be shut down temporarily. As you know, we announced the ALICE COVID-19 Fund. To date, we have received $160,000 in donations. That is far from enough, particularly when we're having literally hundreds of people call already. The average wait time for these calls coming in right now is about 23 minutes. So I ask the folks who are calling to be patient. We are trying to get as much information from those folks calling and give out as much information as we can. But we are challenged in meeting the demand that we're already seeing, and my fear is this is just starting. You can call 211 if you need help, but you can also call 211 if you can give help. As I said, we've announced the COVID-19 Recovery Fund. you can go to our website, hfuw.org/virus, and donate there. Again, there are many, many families, and you heard the mayors talk about it. They're going to be struggling to pay their rent, to pay the utilities, to buy food, and meet other basic needs. That's what this fund is for, to help those families get through this period. But again, we need to have people also help and come together. As Mayor Demings said, this community has a history of doing that. We need your help right now to make sure we have enough dollars to support those families in their time of need. I'll turn this back over to Mayor Demings.
Okay, along those lines, again, our Board of County Commission is being very sensitive to the needs of our community countywide, and I'm joined today by two of our commissioners, Commissioner Mara Uribe and Commissioner Maribel Gomez Cordero, who are here. In addition, we have the Orange County Property Appraiser, who has attended all of our press events. But I bring that up because I want you to know that to the extent that we can here within Orange County, because we at this point are in a healthy financial position, we will use taxpayer dollars to help those who are in the greatest need, our families and individuals. You will see our Board of County Commission take additional action. When I started, I shared with you that we'll be establishing a hotline for crisis assistance, and that assistance, again, is for the short term during the gap of any additional federal or state dollars that will flow into our community. We will have individuals who are experiencing needs now call in through a hotline. We will set that up. You'll get more information about that. The logistics of that hotline and how it will be answered is being established at this point. So within the next day or so, you'll hear more information about that. Having said that, at this point, we'll open it up for any questions that any of you may have of any of the speakers that you've heard at this point. Okay. Yes, sir.
Mayor, you mentioned you were talking to the hotel groups earlier today. How many hotels told you that they were looking to close over the next 2 months, and what was your reaction to that?
There's going to be several hotels that will close by the end of this week. I didn't, as I was on the conference call, I didn't write down the number of all those who said that they were closing, but every one of them at the very least are scaling back. A few of them will remain open because they're small hotels, but suffice it to say that when hotels close, there will potentially be thousands of hotel workers or service industry workers who will be displaced. In some cases, they may receive pay while they're out, and the majority of the cases, they're not going to be getting paid. And so because of that, we know that there will be a need for a crisis assistance in this community, and this is going to require a public-private response. What you heard from the United Way is it's a philanthropic nonprofit organization, but good citizens are stepping up and providing funding to the fund that he discussed to be able to take care of the community. And then we will leverage those funds with the taxpayer dollars to be able to take care of the residents of Orange County. Okay, I'll go to the back and then I'll come to the front.
This question for Dr. Jenkins.
Dr. Jenkins?
Last night, teachers were asked, 25,000 teachers in the county were asked to report to their schools on next week for instruction on how they're going to use virtual learning. Some of them have concerns that this goes against CDC guidelines on gathering.
So we actually have been in discussion with our teacher organization. We believe all of that's already been remedied. You'll hear it announced shortly. I shouldn't preempt the announcement. And suffice it to say, I'm sorry, and let me be clear. So when we talked about initially teachers being on campus, if you're going to do online and virtual learning, a large percentage of our teachers have been doing that already, thanks to sales tax and those students having laptops and teachers using digital instruction. Some of our teachers are in the last two cohorts, so they will need some additional support. And some people may still need to come to campus to retrieve what they need in order to do the work at home, but we believe we have good plans behind all of that.
Dr. Pina?
Yes.
Can we talk to you about the testing sites?
Sure.
You mentioned two.
Mhm.
Is one the big one at the convention center?
Yes.
Tell us more about that. You said 48 hours?
What's that?
Did you say that would be open in 48 hours?
That could be operational by Friday, yes. But the final decision will come from FEMA. That's a FEMA monitor and handle lead site. We will support. There is also private lab testing going on in the community, and we will also be opening our own site, smaller, but we'll be able to address some issues that the larger site may not be able to.
Can you give us the address of that smaller site?
So I don't have the address in my mind.
We'll get it to you.
Yeah. But the thing with the address is we don't want to overwhelm the place. So everyone should call our calling number 477-223-5004. People will be screened, and we will only test those individuals that meet the CDC criteria for testing. So I understand, and we have experience. We are getting about 300 phone calls a day in our call center. And we have experienced people with anxiety, and people get angry, rightfully so, when we say we cannot test you today. But it's because we have limited resources, and those have to be concentrated in those individuals that are more likely to be positive and that will have a greater impact in preventing transmission. That's all that we are doing. Try to find the true positive so that we can cut the transmission. For the larger side of the convention center, people will show up. People will be screened. We will get more details, and those who meet the criteria will go along and be tested, and those who don't will turn away.
Dr. Pino, 3 new cases since Tuesday.
3 new cases were reported today. Yes.
I know in the big scale, little scale, alarming, not so alarming, trying to get a feel.
So you're putting full display. So people should not be misled by the lower number of cases that we have in our county. For some reason that we don't know, we are experiencing a lower incidence than Miami or Broward, where there is double-digit number of cases. We have 9 cases, and we should see a few more cases before the end of the week. And next week is going to be critically important. And people need to understand, now that I'm planning to do an epidemiology class here, but if the transmission go between 5 to 7, 14 days, so every 5 to 14 days you get a new wave of new cases. And then those will transmit it to a larger number of cases. And that's how this multiplies. The fact is that this infection moves very fast. It's very contagious. It's not alarming in the sense that people are dropping on the street. It's alarming that the large volume of cases at once overwhelms the economy, because these people have to be isolated, but also our healthcare system. And that's what we see in a pandemic. And that's where we have to change our mindset. So I don't want people in our county, because we have been lucky so far to have this lower number of cases, not to take seriously the recommendation from the CDC. This could change very quick. And this for us is just the beginning. The next month is going to be critical.
How many people have been tested so far in the county?
I don't know that answer because the Florida website has a state number because we have multiple locations that are testing, and many in the private sector, we don't have control over those numbers.
At the drive-through testing center, what kind of volume will that be able to handle?
I don't have an answer for that right now. All depends on how vast the operation is.
So you were saying earlier, we like something like thousands of tests.
Well,
Is that what you're expecting?
it depends. A site like that could test hundreds of people a day. Yes.
Dr. Peter, what's your message to people at the beaches? I know it's not our county, but as a doctor, what's your message when you see droves of people heading to the beaches?
So again, all these isolations and social distancing apply to everyone, even to the healthier individual. because of course we should be concerned about the elderly and the people with pre-existing conditions, but we also have to be self-conscious of being vectors and transporters of this virus into other settings that will not take it kindly, especially our grandparents, our parents, and elder people that we may visit and come in contact with. So it's important the families isolate, that they stay at home, that if you are not feeling well, stay at home. Call us, call your medical provider, and please treat your symptoms.
Mayor Dyer, we received a lot of videos overnight of some of these restaurants that are primarily restaurants during the day, and then at night they sort of turn into a bar, especially given that it was St. Patrick's Day. What do you want to say to those restaurants? And
Well, we tried to head that off with what we did yesterday, which was to prohibit the sale of alcohol for on-premises consumption. And we applied it to everybody that we possibly could. So restaurants, as well as the pubs and the bars and the nightclubs. Subsequent to what the city did, the state came behind and applied it specifically to bars and nightclubs and pubs, and did a little bit different scenario for restaurants. So we're adhering to what the state has done in terms of restaurants, and that's a capacity issue versus a shutdown of alcohol regulation or consumption. But to your question, I would ask those establishments to comply with what's now been mandated by the state as well as the city. We're going to work in conjunction with the DBPR. The governor gave them the primary responsibility related to enforcement, but obviously, as Mayor Demings had said, local governments with their law enforcement assistants will be working in hand with them to make sure that businesses are in compliance.
does it concern you that some people call this a loophole, that they were able to do this because they're...
I haven't heard anybody call it a loophole, but again, I have faith in our community here in Orlando that everybody's going to do what's right and comply, because again, we're trying to stop the spread of the virus. So adhering to the CDC measures and those that have been put in place both by the state government and the local governments is important to do that.
And have you guys been considering doing what some of these other cities are doing and going to like a total shutdown or shelter in place? Has that been discussed, and what is the threshold?
We have not considered that. As I said in my remarks, we're very cognizant of our small business community and what it means to put them essentially out of business and what it means to those employees. So at this juncture, we're asking them to try to comply with the CDC, try to keep their customers safe, try to keep their sales force and their employees safe. But as everybody up here has said, this changes hour by hour and day by day. If you go back to last Wednesday, think about this. Today, a week ago, was when the NBA said they were going to close down their season. Seems like that was 2 months ago, and it's only been 7 days.
Dr. Jenkins, I have a question here. Dr. Jenkins, teachers are asking not to return next week. The CTA put in a request today. What is your message to them, to teachers who don't want to go back next week?
So we want to honor the collective bargaining process. We think we have a solution there, as I mentioned earlier. Our intent is for teachers to be prepared to instruct from a remote location, and we believe that will probably be their home, but a formal announcement will be forthcoming.
Guys, this is separate from the testing sites, but last night the governor announced that there would be 3 field hospitals, one of them here in Orlando. Where will that be, and do you have a timeline of that?
In terms of the field hospitals, we have some local providers who are doing some things where to protect their permanent facilities from potential contamination. They may be doing some temporary structures on their premises to allow for people to be able to go into it. But as far as I know, Dr. Pino, there's no plan for a mass temporary hospital facility here. That's not that we're aware of at this point. But I also want to go back to the question that was asked of Mayor Dyer about some of the businesses who apparently last night, some of the restaurants who may have remained open. Sometimes there's a lag in the communications. The communications to restrict the number of people in restaurants and what have you it came out in the middle of the day, and sometimes there's a delay in people getting all of the information that's needed. I would hope that those bars or restaurants that may have been in violation of the directive from the governor did not intentionally do so, but it had to do more with the timeliness of the communication and them being made aware. Now, I do know that several locations, our local law enforcement visited and helped to educate those businesses, and we believe that we'll get compliance from them. In terms of what we will do, the question was asked about will there be a complete closure of the community. That is something that will be predicated upon the actual facts and number of cases that we get. We have no illusion here that when we begin testing, we won't get additional cases. Once testing begins, we will not be unique. This is something that is happening across America. As testing occurs, there's no question that we're going to get new cases as a result of that. And so what we're trying to do is ensure that the system of care is able to protect itself, that we don't inadvertently shut down a hospital, we don't inadvertently significantly contaminate or expose healthcare workers, first responders to the virus. So all of that is something that we are working behind the scenes to make sure that it does not happen. Okay.
Speak to the assistance that you were mentioning about in working with your fellow county commissioners. What would be the turnaround time, given that it is in Warren, so answer?
For us, our goal is once we announce the hotline and we are ready, individuals with, in a short period of time, a day or so, will be able to get funds. So by the end of next week, we hope to have dollars in the hands of those individuals who have the need. Okay. Other questions? I didn't quite hear the question. It is my understanding that one of the TSA officers that works there tested positive, just happens to live in another county, and so not counted in the Orange County numbers. And then there was a worker that was at an off-site facility associated with the rental car business that also lives in another county, and that individual is not being captured in the Orange County numbers as well. But the airport has taken the precautions regarding individuals who may have worked around them, contacted, been in contact with them, they've sterilized those areas, they have made appropriate referrals. And so today there was a Greater Orlando Aviation Authority board meeting. The executive director from the airport reassured all of the board members, Mayor Dyer included, that they have done what is necessary to make certain that the area was completely clean and sanitized.
Mayor, to be clear then, 3 people who work at OIA have tested positive for the virus?
Not 3, but 2, yes, that worked. One was an off-site rental car facility that helps to service the airport is what I'm told, and the other was a TSA worker.
We can take one more question. Steve in the back, I think, had a question.
Mayor, there's been a lot of talk nationally about whether or not the hospitals are properly equipped with ventilators and other equipment to handle it. Have you had any conversations with hospital officials or any of the doctors?
Interestingly enough, immediately prior to this press event, I had a conference call with healthcare providers, the large hospital systems here, and Dr. Pino was on that conference call. And given the current landscape and the numbers that we're talking about, they have adequate facilities. But again, that's why that becomes really important for us to isolate the virus and not allow it to spread, because Obviously, if it's spread, the more we will lose capacity within our existing hospitals to be able to deal with a widespread infections, disease spreading here within the community. I will tell you that when the National Guard was deployed here, when the governor deployed them throughout the state, part of that is because they have the staffing levels, the capacity to be able to ramp up quickly and to respond to large numbers. And so with all of that, I think, being put in place within this last week, we are responding appropriately, and our goal is to get in front of this, to slow down that curve of the increase of the virus throughout our community. Okay. Yes, it's the same one. The same one that we're referencing here. Okay. All right. Thank you all for being here. Hopefully this has been informative to you. We'll endeavor to keep you updated. Thanks to our staff. They are working almost around the clock now, putting out information real time and responding to questions via social media that we're getting from our public. Thank you.